You know, for well over 100 years, the idea of surgically correcting someone's face has gone from being this incredibly dangerous, life-threatening thing to, well, to a fascinating art form. And right at the heart of that whole transformation is one of the most common and, honestly, most ingenious procedures in modern surgery.
So that gets us to the big question, right? If a person's lower jaw is too far forward, or maybe too far back, or even just a little bit crooked, how do you actually physically move it? The answer is pretty amazing, and maybe a little startling. You split it. Yep, you heard that right. You split it right down the middle, lengthwise. This incredible procedure is called the Bilateral Sagittal Split Osteotomy, or, a lot easier to say, the BSSO. It literally lets a surgeon slide the jaw into a brand new position. So let's break down exactly how this works. Okay, to really wrap our heads around a BSSO, we've got to know what it is and where it came from. Its history is this incredible journey of surgical innovation. So let's break down that mouthful of a name, bilateral sagittal split osteotomy. Osteotomy is just the fancy medical term for intentionally cutting a bone. In this case, it's the lower jawbone, the mandible. Bilateral just means they do it on both the left and right sides. And that sagittal split, well, that's the magic trick that allows the bone to be moved with amazing control. And believe me, this didn't just appear out of nowhere. The very first idea goes all the way back to 1907 with a Dr. Blair. But the real game changer came in 1955, when two doctors, Obwegesser and Truner, figured out the modern technique. And ever since then, surgeons like Dalpont and Hunsuck have been refining it into the gold standard procedure it is today. Okay, so why on earth would you go through a surgery this complex? Well, the reasons are actually super important. We're talking about things that affect how a person eats, how they speak, and even how they breathe when they're asleep. So a lot of the time, it's to fix major bite problems, like an underbite or an overbite, or to correct facial asymmetry. But what's really fascinating is its use for obstructive sleep apnea. By moving the jaw forward, it literally pulls the tongue forward and opens up the airway. For some people, that can be completely life-changing. And of course, it's often a key piece of even bigger two-jaw surgeries. All right, now for the main event, the split itself. If you can understand this part, you'll really appreciate both the elegance and the challenge of the BSSO. Now, the crucial thing to get here is that the surgeon isn't just breaking the bone. Not at all. It's a highly controlled separation. The absolute best way to think about it is like splitting a log of wood. You know, if you hit it just right, it splits cleanly right along the grain. That is exactly the goal here, to separate the mandible along its natural weak plane, not create a jagged, messy fracture. And this visual just explains it perfectly. Over on the left, you can see the jawbone separated into two distinct pieces. Then look at the right. You can see how that front piece, the part with the teeth, can now be slid forward or backward and then locked into its new perfect position with tiny little screws and plates. So let's get our terms straight. You've got two pieces. The proximal segment is the part that stays put. It's got the condyle, which is the knobby bit that connects your jaw to your skull. Then you have the distal segment. That's the piece that has all your lower teeth in it. That's the part that actually gets moved to fix the bite. All right, let's head into the operating room, metaphorically speaking, and see how this all comes together. We're going to walk through a simple four-step overview of how a surgeon actually pulls this off. The entire operation really boils down to these four key phases. First, you make the incision to get to the bone. Second, you make the super precise osteotomy cuts that will guide the split. Third, you actually perform the split. And finally, you fix the jaw in its new home. First up, the incision. And honestly, one of the most incredible things about this surgery is that the whole thing is done from inside the mouth. The surgeon makes a little cut in the gum tissue way back by the molars, which means there are absolutely zero scars on the outside of the face. Pretty amazing. Okay, next are the osteotomy cuts. Using a special surgical drill, the surgeon very carefully cuts through the hard outer shell of the bone. They're basically drawing a dotted line for where the split is supposed to happen. You can see them here making that precise cut. Precision at this stage is absolutely everything. And this is the moment of truth, the split itself. The surgeon slides these thin, specialized instruments called osteotomes into the cuts they just made. Then, with some very careful tapping and gentle twisting, they encourage the bone to separate right along that path. This is easily the most delicate and skill-intensive part of the whole surgery.
But what happens when that nice, clean split doesn't happen? This is where the surgeon's skill and experience are put to the ultimate test, because something called a bad split is a really serious complication.
And the source material we're looking at is crystal clear on this. It says the absolute best way to handle a bad split is to prevent it from ever happening in the first place by following every single step with meticulous care.
And here you can see the difference plain as day. On the left, that's the goal, a perfect, favorable split. But now look at the image on the right. See that bit in panel V? A whole piece of the outer bone, the buccal plate, has just snapped off. That's a classic bad split, and it makes putting everything back together way more complicated. But probably the single biggest risk involves a nerve, the inferior alveolar nerve. It runs right through the center of the jaw and gives you feeling in your lower lip and chin. In a bad split, like you can see in panel A, the nerve can get stuck to the wrong piece of bone. The surgeon then has to carefully free it up to prevent permanent numbness, which is a huge deal.
So, despite those risks, when it's done correctly, there's a reason the BSSO is considered the gold standard. Its benefits have made it the most common jaw surgery of its kind in the entire world.
And here's why. That special split creates a huge surface area of bone touching bone, which is just fantastic for healing. It lets the surgeon lock the jaw in place with super strong fixation, which means patients can often start moving their jaw pretty soon after surgery, no more having your jaw wired shut for weeks. And the best part? It delivers incredibly predictable and stable results that can last a lifetime. Which really brings us full circle, doesn't it? This procedure is the perfect blend of hard science and delicate surgical artistry, literally reshaping anatomy to give people back both function and form.
From a dangerous, almost unthinkable idea back in 1907 to a routine, refined procedure today, the BSSO has come an incredibly long way. It just makes you wonder, what are the next 100 years of surgical innovation going to look like?